And we're beginning now. Got a lot to cover vis-a-vis viruses. I will not get through all I want to cover today. I still have the last group, so I'll probably have to send you some supplementary information, and I'll have time to do that. Undoubtedly, maybe I won't get to it till tomorrow, and then it'll leave us a whole day, a whole class on Friday to review. So we'll be able to. It's you've got all the information vis-a-vis that the exam. I had a previous recording, but and then we'll so listen to it. Think of some questions. I'll do the review again on Friday when we get here. That's what we're going to do. I think we have to just dedicate the day to that. So I'll try. I may have to send you this in recorded fashion, just in the interest of time. So without further ado, let us do. That's clever. All right, kind of where we left off. Yeah, don't bother me with that nonsense. So we were beginning to look at RNA viruses, and we had finished the DNA viruses, ending with the herpes viruses. Again, if we're going to frame RNA viruses, they mutate. I'll give you some examples. There's only 3 of these of any consequence to us that are naked viruses, and the big problem is they're the ones that most commonly affect us. So I commented to you, I believe, about rotavirus down in the Southwest. You recall me talking about that a little bit at the end. And again, just to reiterate the point, when you go to an area you're not familiar with, little kids and very old who have never been there can be infected. Like I said, we spent an entire vacation, I did, staying in Santa Rosa Children's Medical Center with my now 41-year-old son near death's door. That's no way to spend a vacation with a 10-month-old. Way back in New Year's 1983 to 1984. So don't make the same mistake that this doctor and that nurse did, doing that kind of thing. And again, this is a virus that I believe they're doing a lot of immunizations for. I mean, our population inevitably is changing, and we get an increased filtration even before all these border-related issues, which are not germane to this discussion. But there's a rising amount of folks who have immigrated to this country from those areas, and we have seen an increase because anytime people come from another area, whether it's South America, whether it's Asia, whether it's probably not Northern Europe, they're going to bring a whole subset of interesting things that we aren't necessarily that familiar with biologically or infectious diseases. So I'm not making a big deal out of it. That's what life's about. You never know where you're going to end up moving to or what you're going to be doing, and that impacts you. Things like that. I've lived in the Northeast my whole life. Watchword for that is cold. Next Friday at this time or a little later, I'll be looking at an ocean. The beach. So no class, obviously. Moving on. Norovirus is, the best way to describe it, used to be called Norwalk virus. It closed down a school district here whose name I always keep forgetting. My son's best friend went there. Down in the Mon Valley, and the cruise ships turn around. These viruses are very easily spread and survive for long periods of time on surfaces. They are shed before people know they are sick, and unfortunately that's where the illnesses come from. So you should just remember them as being easily and very difficult to remove from surfaces. And a lot of times before the full-blown diarrheal vomiting disease occurs, you're way past the contagious. And unfortunately, people are not ever great with hand care consistently, even though they should be. So that's sort of the underlying thing. The last one of these naked viruses is the largest category that infects us more than any other category, and they're called pico-RNA viruses. We sometimes call them picorna when you pronounce it all as one word. Pico means tiny, really tiny, even tiny by microscopic standards. And this is the first, herpes was an example. This is the first RNA example of viruses where the 2 I mentioned before are clearly fecal to oral. Here, they're based on size, genetics, and whether they're enveloped or not, and their architecture. So they're isometric, but the reality is there's 2 families. Rhinovirus, the common cold, which is respiratory. There's a lot of different subtypes. That's why for two reasons. No one's ever bothered with the vaccine because frankly, vaccines have more harm than good in a disease that's non-fatal. There's more complications with vaccine administration than the likelihood of fatalities of someone getting a cold. Okay. And that's the reality of it. I mean, vaccines, no matter how much we've become reliant on them, are never going to be innocent. When you're tinkering with the human immune system, there's always problems. Secondly, so the common cold is rhinoviruses. The more interesting category are entero or enteric viruses. That enteric means gastrointestinal, typically highlighted by everything from vomiting to diarrhea to nausea. And we've all gotten them, and we erroneously call them a stomach flu. And the reality is they're not necessarily anything. There's really nothing scientifically called a stomach flu, but that's how we refer to them colloquially. That's fine, like the Yankees hat. I'm with you. You're wearing a Yankees hat. Yankee fan. You know who the hat was for?
I forget what hat it is.
It's not a Met hat. Different. Thank you. When I was a kid, during the Yankees were winning everything. Mickey Mantle, famous people you may have heard of years ago. Moving on. So those, and the interesting thing is not so much them, but they can be big problems for the very young and very old, because vomiting and diarrhea means fluid loss, problems with electrolyte balances, and those are the ones who are affected. So they're not innocent in people who are very susceptible. And so we really are very, very watchful of those, particularly in little kids and the elderly. Which brings us to two players who are in the subset of enteric viruses, which are all fecal to oral, and it may surprise you. Two very famous diseases, both with interesting ties to this area. One is called hepatitis A, because there's a lot of hepatitis viruses. They're not all the same. They do hepatitis not by number, like COVID-19, but by letter. And A, and I think hepatitis D, which you don't hear a lot about, are both fecal to oral. This is, again, very easy to pass. And the most famous incident of the entire United States happened right here in Beaver Falls, PA, when a restaurant chain in bankruptcy folded because about 1,000 people got hepatitis A and 4 people died of varying ages at a restaurant called Chi-Chi's, which was right off the Turnpike exit. That happened 20 years ago, fall of 2003. Okay, and it came from, they were using raw green onions, scallions, spring onions, whatever you want to call them, as garnish in salsa and dishes and things like that. Those onions had come sealed, as most of them do, typically from Mexico. It's not an indictment of produce from another country. Any produce that's marketed in this country is supposed to undergo a power wash, high velocity water to wash off dirt and stuff. This comes from human fecal material. And if you didn't know in the fields, whether it's in Mexico or this country, there's no porta potties in the field. You get the idea. So if somebody was sick, it's easy to contaminate it. So the next time you get that thing that says pre-washed, do me a favor, wash it. I know it's easy to bag a salad. I didn't see him wash it. You didn't see him wash it. She didn't see him wash it. Wash it. So, and it's what I do routinely when I chop up green onions, and if I'm going to do them raw, I wash them really good. Same thing with leeks, by the way. There's a lot of sand and grit that gets. And that was hepatitis A. We now have a vaccine for hepatitis A, which is effective and has really limited the problems with that. And I don't know how popular it is, honestly. But then we use something called gamma globulin, which is the traditional treatment, which was like a bolus of generic antibodies, which were a stock and trade treatment for a lot of infections. You figured you'd boost the antibodies, and hopefully it would be in that, something that would address this particular virus. The other one that's as Pittsburgh as any other virus ever was is polio. Most of you have not ever seen, other than maybe seeing a historical picture, or learned about Franklin D. Roosevelt, who had polio, and even throughout his entire presidency. And the idea was people didn't know what it was. In the day it was called, back in the early 1900s, they called it infantile paralysis. They did not know how it spread. If a kid got polio in the neighborhood, they were shunned. People wouldn't go near the house. They thought it was catchy. The reality is it's a virus that affects the nervous system that comes from contaminated water. So typically an animal has fouled the water in some way, shape, or form, probably the origin of the virus. It's mutated. It's an RNA virus. It's become, and in some way, shape, or form, it began to infect people. Roosevelt ostensibly got it when he was addressing a Boy Scout group when he was running for one of his presidency terms in the 30s. And this is what happened. You wake up the next morning and you can't feel your legs. You feel like a little stomach ache, and the next thing you know, the next morning, oh my God, paralyzed. And paralysis would ascend. And in the old days, we had no treatment whatsoever. They didn't have ventilators. They put kids and adults in what's called an iron lung. And that was historically, you just iron lung, Google that. And what it would do is it would create a vacuum and pull your chest out and effectively breathe for you. And eventually, not everybody, but a fair amount of people regained some muscle control. They ended up with horrible contractures because whatever muscles came back, the flexors overpowered the extensor. And it was just, I treated a lot of patients, braced a lot of patients with polio. That's all you could do. So that was a scourge of a disease, and people were terribly worried about it. And in Pittsburgh, one of our previous professors here who taught micro here, and his first name was Norbert. I can't remember his last name. Very famous, still alive. He worked with Jonas Salk at the University of Pittsburgh on the original vaccine. Okay, that vaccine was started given around the mid-50s. I got that vaccine, and everybody got that vaccine. Interestingly, later on, about 10 years later, they discovered that the virus was fecal to oral. And they developed one of his colleagues, who possibly was a relative here at the university, developed an oral vaccine. And the entire nation, you did not know this, ask a grandparent. They were around, I was about 14 or 15. Every community center, hospital, church, ours was at the high school. We had a community of about 15,000 people. Everybody went to the high school. We all came there on about monthly intervals on a Saturday, and the doctors and nurses and the people in the community would go over the census rolls, and you would come in and they check your name off. They give you it was a sugar cube, and they put a drop of this red liquid, and they gave it to you. So we all became, it's trivalent vaccine. They give it to you same way they do it now for infants, though I understand they've changed the formula and it may be by injection now. So I'm not up on how it changed. But imagine that an entire nation became immunized over a period roughly in 64, 65. The neat story that's associated with it and how things have changed today is, I think for the second one of these, I was sleeping over at a buddy's house. His dad called my dad Friday to Saturday because we were doing some kind of sports activity. And he goes, hey, Lou's over here. We're going to take him to the high school when we go. And my dad says, oh, great. Take care of it. I'll tell him you're bringing Lou and getting the sugar cube for him. We're going over early. Imagine getting a child, 14 or 15-year-old child, an immunization without their mom and dad today. Legally, nobody would touch it. Times have changed a lot. The fancy word is litigious. Everybody's looking to sue somebody else. So it's interesting aside from what went on, like it was yesterday. So it was very interesting, and older relatives would probably have a certain amount of remembrance of these and wherever they had that done. So those, interestingly, one affects hepatitis, liver is part of your GI. But polio, it goes to your nervous system. So the fact that it enters your system one way doesn't necessarily mean it exits the system or affects that same system. And not only is polio like that, you can't catch polio from another person. That was a tragedy. You have to get it from the contaminated water. Now, if they contaminate the water, you can get it from them because they probably shed or released the virus if they were in water that used a common area that people bathed in or drank and it wasn't properly taken care of. Neat story. Now, here are a couple of ones that are pretty interesting. Now, for the rest of these are all enveloped. So when you remember these, remember it's all this. And I told the other class, I'll tell you the same thing. One of the questions will be, basically, I'll give you a list of like the different virus categories, like rubella, and there'll be a disease. And you're going to see it's it will be a toga virus, will be the category rubella, which by the way is German measles. Okay. And you'd have to know the name and the category. And so all the ones I have listed on the study guide are in there. Another one will have 4 answers, and it's matching. Fecal to oral, respiratory, zoonotic, sexually transmitted, whatever, blood, body fluids. Okay. And it's a question of what diseases, and these are the ones I highlight here. So those are at least 10 of the points on the next test, so to speak. So it brings us to the first. They called it toga because microscopically or electron microscopically, they called it was a cloak. Toga, ancient Rome, a cloak. So there's 2 in this category. Chikungunya you don't see a lot of. It's not a major, but it's people get sick and weak. Interesting, it was carried by mosquitoes, and we first saw it in the Caribbean when they were getting deliveries from Africa, and mosquitoes in Africa had brought it. It was originally in Africa, and that's how it can cross big borders. It wasn't the virus so much, but the mosquitoes that were carrying it. Just as an aside, I'm not going to ask you about it. Rubella, I will. Rubella is German measles. Most people don't even know if they have German measles. It was one of the 4 what we call usual childhood diseases: chickenpox, measles, mumps, rubella. So your MMR, measles, mumps, and rubella. Measles are called rubeola for ruby red spots. Roseola we talked about. Rubella is sort of a similar red, but not very. It's very faint. When I had it, you could hardly see the rash. The most notable thing was a relatively low-grade fever, feeling kind of spread respiratorily, and you felt this behind your ears. You're called preauricular nodes, big bumps. Hurt like anything. Remember, the tragedy is that it's a minor infection. By the time you're sick and you're coughing a little bit before that, it is easily spread to pregnant women. It crosses the placental barrier, and before the MMR immunization, has been around since the 80s, mid-80s. My kids all have that. And my daughter, as I told you before, was born in 1986. When we went to school, and I don't see it in these classes, and you can correct me if I'm wrong, is we every class had kids who were in speech therapy, had hearing aids, had trouble speaking because they had trouble hearing. It affects, in the first trimester, the central nervous system, and particularly hearing and speech centers. Every so often, historically, there have been, when they had a problem with the vaccine, they would get what they call a rubella bulge. And you see that. You rarely see that as much today. It's not to say it doesn't exist, but in this country, I'm telling you. So that's really one of the significant features of MMR. It really eliminated a problem that all of us got. I got all of those 4 diseases except the mumps. And when the mumps immunization became available, I got it because I had just gotten married. We were going to start a family, even though we weren't successful in doing that. But the physician gave me that and said, look, you got to wait 2 months before you start, because conceivably we could have a problem with this if there was a pregnancy that developed early in the trimester, just saying. So that's why we administer it to younger folks, because we get that problem typically out of the way before childbearing years. Okay, so that covers that. Enveloped virus, easy to get rid of, but the trouble is you don't know when you have it, and it's still very prevalent. Flavivirus, I wrote them up there. Flavus is like a Latin term for yellow. And so all of these typically affect the liver in some way, shape, or form. And when the liver is damaged, we see that because liver can't get rid of the breakdown product of hemoglobin called heme, and that colors our urine and feces. It's called bilirubin. And it's converted, depending on the system, into what colors our urine and feces. Okay? So if the liver is damaged, that backs up into the bloodstream and you get yellow. It's called jaundice. So there's a lot of things that can cause it. These are viruses do it. Most famous of those, surely, yellow fever. Yellow fever, dengue is the way you pronounce that, by the way. Zika, one that's not listed here, West Nile, are all transmitted typically by insects, mostly mosquitoes. And so we first encountered this in this country when the Panama Canal was being dug, effectively through a rainforest. And the people who had come from the United States, North America, were getting this terrible fever and jaundice, and the natives actually pointed them to the remedy, to the different remedies they were using, basically quinine alkaloids and similar things that are used today in some of the treatment for this. And we use a lot of that in malaria, which also affects the bloodstream in that regard. So there's a lot of history associated with these. If you go to one of those areas on a medical mission or on a travel for a vacation, you have to be very aware, particularly of sleeping, because that's when mosquitoes are busy. If you're in an area that's unenclosed or you're like in a cabin or something, mosquito netting is vital. That's when these problems develop. There's not a whole lot. I don't think there's anything you can immunize for, per se, with that. That's there. So they are problematic. That's where they derive their name. The odd player, all of these are zoonotic. The oddball is hepatitis C. And again, these ways of spreading are not the only ways of spreading. These are the most. Could you conceivably get hepatitis C some other way? Sure. I suppose you could. Okay. Maybe it could be carried by a vector. I do not know. But these are the ways the most common ways they're carried. Hepatitis C, by definition, is blood and body fluids, sexually transmitted. It is mostly from shared needles. Okay, why needle exchange programs have value, whatever your feeling is about that with regard to drug usage. And, I mean, theoretically could be sexually transmitted. Up until 1987, there were two diseases that blood contaminated, one of which we will not get to today, HIV, and the other one was hepatitis C. Hepatitis B, by this time, was under a fairly good degree of control, and immunizations were becoming readily available. Okay, that was the hepatitis that we worried about vis-a-vis blood transfusions. We didn't know about hepatitis C. Oh boy, did we find out. My first wife had her ovaries wedged in 81 at Shadyside Hospital. It wasn't some little tiny hospital, big part of UPMC, by a very, very prominent OBGYN. She ended up with a bleed. They didn't know she had a bleeding disorder called von Willebrand's. He gave her 2 units of blood. Okay, she was exposed to hepatitis C. We didn't know about that until when her health really deteriorated and she was on drugs for psoriatic arthritis that weighed down her immune system. All of a sudden, they identified that because she had a blood splatter when she was working in a nursing home. She was in charge of the nurse. She was running the nursing home. She was in charge. Not the charge nurse. She was the night and evening supervisor. Got a blood splatter when she's drawing bloods. Her boss, the nursing, the directress of nursing said, you got to go to occupational health. I get one of those calls, 2004. Oh my God, I've got Hep C. Well, she had positive titers. Thankfully, she didn't have any in her bloodstream. Because when they do those tests for HIV and Hep C and things like that, they look for antibodies. So she was Hep C positive. But it didn't mean that she necessarily had the disease. However, with her health not so good in these last 20 years, we're aware of the fact, my kids particularly, because they really are involved more with their health, that it could occur. So everybody, many of you are going into fields where you're dealing with starting IVs, intravenous things. You can get blood splatters. Know the patients. You have patients, extra precautions. And don't worry about transfusions anymore from the blood bank. After 1987, they're extraordinarily safe. Extraordinarily safe. So that's an important little nugget that's in there. Now, we didn't have treatment then that was really very good. Now they have some very good antivirals because we saw a real uptick in hepatitis C. And I hate to put it like this, when pharmaceutical companies see a way to make money, they do. They make money when people get sick, unfortunately. So you'll see a ton of advertisement. We didn't see that 20 years ago whatsoever, which brings us to everybody's not favorite topic, corona. Corona means crown. So its name came from the external envelope, which I guess to anatomists, microanatomists, look like a crown. It's the first one of these RNA viruses that's not considered isometric. It's in this sort of odd range that might be pleiform and it might be might be helical or filamentous shape, is odd. And what's unique about it, it has multiple strands of RNA. And we'll get to that. A better example will be influenza. It behaves like influenza in the sense that those RNA strands mutate. And there's multiple hosts, which means it's not just us. It can be other members of the other mammals or members of the animal kingdom. Just like influenza, people, birds, pigs, bats, raccoons, different members of the animal kingdom, not all necessarily mammalian, can have aspects of this virus. Okay? And because of that, COVID-19 became what was called, and there's a couple of others I'm going to mention that I have listed up there, novel viruses. Novel means new, unexpected, and typically it's where RNA from different species have come together. That's and if you did not know it, our viruses work through where bacteria make toxins. Viruses, it's mostly because of our immune system. It's your overabundant in COVID-19. What made people have extraordinarily problems breathing was it basically that became what we call pro-inflammatory agents. It attached to receptors in your lung and released chemicals that didn't make it slow down, but accelerated it. Fluid, swelling, all those things. So it caused an overly abundant immunological reaction. Not the other way around. Typically, a virus may trigger a response, but usually your immune system, if it's not too numerous, will keep it in check. So a lot of people had significant problems with that. And you'll get more on that when we do respiratory diseases. Again, the first one of these we thought was a bioweapon. It happened after 9/11, called SARS, which was SARS-COVID-1 was its true name. We called it SARS, Severe Acute Respiratory Syndrome, is what the acronym stands for. And people were on a plane from Japan to Canada, and people got sick and died, many of them. They're in a closed environment. Somebody had a very contagious case of it. It's easy. Hey, how many people do you know have come back from a plane ride and next time they're testing positive a couple of days later for COVID? I bet you everybody in this room knows somebody that has that anecdote. Happened to my sister when she was away in Paris. I'm going to Jacksonville. She went to Paris for 3 months. What's wrong with that? That was for her 55th anniversary. That's a lot of years. Continuously. Moving on. It turned out it wasn't a bioweapon. It was just this unique or novel virus. Next step. Okay? At MERS. It wasn't only in the Middle East, but it was another coronavirus. Coronaviruses usually were just cold viruses until then. That somehow underwent a change, and we saw more of it on our soldiers who were over in Desert Storm and related campaigns in Iraq and in those regions, or in the Gulf Wars at various times, if they were particularly on ground. My son was there for at least a year, but he was on a ship, in the Gulf. So, so a lot of people were exposed to that. Is still for Middle East respiratory syndrome. Not even listed here in this chart until they updated was SARS-CoV-2, which we all call COVID-19. Now, whether its origin is suspicious in nature, whether it came from a lab accident, whether it came from an open air market, as many would have suggested, short answer is I don't think we know. I think, like a lot of things, over time, truth tends to come out. So we'll find out more about it over time. But the reality is it's with us now. And what these viruses tend to do is they continue to mutate. And as they mutate, fortunately, they become less. Typically, sometimes they spread easier or difficult. Most of the time, they become less severe. So now, and the COVID restrictions are now relatively reduced for quarantine. I don't know what the school is doing for them. We have to follow the policy of the school. UPMC had done away with the mask requirement. It's now back in as of December 20th, I believe, of last year. It will probably go away by April because it's prime time for respiratory problems. So for all of you, yeah, most important thing I think for any of these is to exercise a certain degree of caution. I don't get particularly worried about this stuff. So, I if I tested positive, I wouldn't come in. I teach remotely. I wouldn't want to expose anybody. I wouldn't worry about it. That's me. Two viruses. This is where I think coronaviruses, it's not clear what their structure or anatomy is. It is for these, rhabdo and phyllo. They are truly filamentous or helical viruses. The viruses are sort of in a linear spiral form inside their respective containers. Rhabdo is really where the name rabies comes from. I don't know what rhabdo means. Rabies is everywhere. Rabies affects effectively all members of the mammalian family. The reality is, for any of you, if you are bitten by an animal in the wild, even scratched by an animal in the wild, potentially being contaminated by something particularly bitten, and you do not know if that animal, even if it was a domesticated animal, if you are not sure that it has had rabies prophylaxis, you have to be considered exposed. The people who are most often treated today for rabies work in animal shelters or for veterinarians or are veterinarians. They work around animals. And, animals are going to bite you. They just are. Periodically. Scratch. Pardon me, sneeze. It's, so by classification, it's zoonotic. It is not the only way. This is a nursing anecdote, but it applies to anybody in patient care. Back in 1980-ish, lady lived up where my wife grew up, 2 doors up from her mom and dad, when mom and dad were alive, and lived in that neighborhood called Stanton Heights up in Pittsburgh. Nice neighborhood, and in the East End. And they ended up, and she ended up being exposed to rabies. Not from a dog bite or a cat bite. She had a patient. She was a psych nurse at St. Francis Hospital, which is where Children's is now, of course. And so she bent over, taking care of this patient, and they thought he was in a mental health unit. They thought he was, whatever, schizophrenic, whatever word they were using. He bit her. Well, be careful, everybody. If you're going to nursing, be watchful. Don't get too close, particularly with agitated patients, to get help. Anything will come your way. Anything. You get my meaning? Without getting too graphic. He died a few days later. In the autopsy, they found out he had rabies. She had to go through what's called the rabies series. Back then, 50 years ago, it was a series of extraordinarily painful daily abdominal injections for 2 weeks. Now, it's a much easier road with intramuscular injections for a week to 10 days. I know a lot of students over the years who worked in veterinary hospitals and clinics, and hey, it's good for 6 months. If they bite us again, we have to go back and get the shots for 6 months. Happens all the time. So it's a little more friendly. Understand, it's typically domesticated animals are not a problem. My dog will love you to death and knock you down in the process. All 75 plus pounds. Wow. Squirrels, chipmunks, foxes, bats. If you go caving and you like to do that type of stuff, even bat urine, if you inhale it, or bat guano, bat droppings, are all highly contagious. And bat guano is really bad, bat urine. So be careful with that. I can remember to this day, I always tell this one, my daughter, she was like between first and third grade, we had a Y group where the dads and the daughters bonded. We went to Y camps. Okay. And the one we were at was out here. It was Camp David. It was out near Somerset. Really nice. Great time. Dads and daughters together. Lots of fun. Lots of hikes, lots of activities. And they had little chipmunks. And all the little girls wanted to pet the chipmunks. And I'm like, don't go near them. They're all rabid. They all think they're Simon Alvador, Theodore and Alvin. They had just seen the squeakle, Honestly, I'm like, no. Oh, we're going to pet chipmunks. Not on my. I'll go run over and chase the chipmunks away. They're all yelling at me. I'd rather you didn't have rabies. Did I mention about not having children if possible? Grandchildren are good. Nobody here with any, no grandchildren? No. Yeah.
Do I have grandchildren?
I was just wondering.
No.
Somebody in my high school class married an older person and ended up with like step grandchildren when she was like in her 30s. One of those deals. Whoa. I worried it would be my daughter. I told you about the daughter, remember? She's very nice now. Thankfully. The guy's only a few years older than she is, not 26 years old. I digress. Which brings us, so rabies is that. Ebola, very famous disease, never had a case in this country until Ebola was confined to native villages. When I first started teaching this 20 years ago, Ebola was a dreaded disease, usually passed from contaminated water. An animal with it would die in the water supply in a native village in sub-Saharan or equatorial Africa. And it was named for one of those regions. And everybody in the village used the same water supply, and they all got sick, and 80% of them died. And the treatment, there was no treatment. Your treatment was quarantine, and the vernacular said we're going to let the disease burn itself out, which meant once all the people died who were going to die, then the people who survived were going to be okay, and we could go back in and do what we could for the village. Horrible. There's no treatment, no antivirals. As the disease began to spread to larger areas like the Ivory Coast and Liberia and some other areas along the Atlantic coast of Africa, we saw a real uptick in the disease. And so there would be, it began to move to large populated areas. So we've had several cases where Doctors Without Borders and UN and other agency-sponsored groups, it's almost, we don't know how it spreads. We thought it was that way. Contact can spread it. Can you get it on your hands and get it on your face and somehow ingest it? Possibly. Indeed, people, the hospitals there were like dirt floor hospitals. They were actually very good. You would only work fully gowned, gloved, masked, suited, hooded, and it was so hot for about, it's very hot, hot humid country, 40, 45 minutes. When you came out, you had to have, you couldn't just take off your clothes and get decontaminated in a special shower. You did eventually. You had to have someone read you the instruction book on what to remove first and in what order, because it was so easy to cross-contaminate. They had a doctor and a nurse who were there, who came back to this country. We had several hospitals that were good on the protocols. One was Emory University Medical School in Atlanta, where they successfully treated. And we found out that there was good treatment that was available, and the death rate was substantially down, under 50%. Some hospitals tried to treat people that weren't equipped to do so, and they didn't know the protocols. And one of the nurses treating a gentleman who came in, and they didn't know he had Ebola, but got it. He must have been carrying it and got it after he landed in this country. In Dallas, one of the nurses became infected and I think died. So these are places that there's really big protocols. And I've had a lot of students over the last 25 years who have gone on medical missions, have gone to areas where they've been exposed to a lot. It's very rewarding. I almost went on one many, many years ago. It was less of a mission and more of going to India to do in a very uninhabited area. That was probably 30 years ago. But with kids, it was real hard to believe. But I think it's a wonderful thing that people can do. And we have two more things to cover in about the 10 minutes we have left. Okay? And so Ebola, highly contagious, not sure how it spreads, highly deadly, certainly would be a bioweapon potentially. Conceivably, so we're very, very watchful about this, which brings us to these two that are very similar in both respiratory. How paramyxo and orthomyxo. Myxo means mucus. So these are cold flu type viruses. All spread respiratory. Para means alongside of it. Ortho means stream. It has to do with the arrangement of the RNA. The only one that's really critical is the orthomyxo, which is classic influenza. There are three major respiratory diseases that are seasonal now. Now we worry about it. We worry about the student population here. COVID-19, influenza A, and RSV, respiratory syncytial virus. They were all potentially deadly, and some of them are comparatively good, can tolerate fairly easily, depending on the strain. Now, but that's what's common around here now. Paramyxo are ones that they mutate a little, but not excessively, would be the way to describe it. RSV is the one that is most severe and the one we worry about, particularly now in people who are at risk, very young and very old. I might have it in September, and probably was in bed for 10 days. So my fall classes was pretty concerned. So, just coughing, hardly talk, that type of thing. And we don't even know where she got it. This was COVID-19. That's infantile respiratory distress syndrome. That's common in newborns and preemies because they don't manufacture something called surfactants until roughly the 26th week of gestation. Syncytium means it causes the lung cells to fuse and you can't do the exchange. In older kids, toddlers, it's the croup. It's not as severe. It sounds horrible. Every parent that my age had a croupy kid. Nowadays you have, cool mist vaporizers and things like that. The kids would start to make these horrible sounds in the middle of the night. And we'd have to put them in, I'd have to put them in the shower. And close all the windows and doors, make it into a steam room. What's the truth? Moist air, hot or moist air. The coolness vaporizers are really improved over time. So the croup isn't bad, it's just frightening sound. High pitched kind of a sound. Oh my God, the kids go to that. Measles and mumps will cover. Measles is respiratory, and although it causes a rash on the skin. Mumps is respiratory, but it affects salivary gland. Both of these are easy to deal with as children, and obviously we have an immunization, but very bad for adults. Most of these diseases have high fever and a lot of complications. Mumps, for instance, cause infertility. It's more commonly in men than in women. It affects glands, and the ovaries and testes are glands. Measles can be deadly. It's the third largest killer in equatorial Africa. Parainfluenza is more of a mild flu. The last one on our list is orthomyxo. That's the flu. If you think you've had the flu, you probably didn't have the flu. You're probably going to be in bed for a week. 2 weeks, come to school for a week, maybe a week later. 2 to 3 weeks. They used to call it the grip. There are a lot there. That's in a severe influenza A. Or and it could be anything because your immune system, vomiting, diarrhea, headache, can't breathe, can't talk, pain every time you try to take a breath, all that stuff. Lift your head up and things start to float around. You can hardly keep it. What happens is this: it has 7 to 8 single strands. I haven't drawn that many of RNA that are identical. And what they do is they kind of flip-flop places. One piece can move from one strand to the other, and it changes the important aspect of it. The way viruses hurt you is they have little spikes called protein spikes, and it's a sphere outside the envelope. And it has alternating spikes of 2 different types that we're going to go over at length in respiratory disease. They have famous names: hemagglutinin, I don't think you have to know, and neuraminidase. They're always misspelled. And those spikes are enzymes. This attaches to the cell in your respiratory tree, and this allows it to release. And so they're hard names, so we have a nickname for them. We call them H and N. H and N. And so those H and N spikes will, whenever these subtle little changes occur, causes the spikes to subtly change. We call it antigenic drift. And it means the flu vaccine from last year is very unlikely to work this year. Okay, you're trying to epidemiologically figure out which vaccine is going to work and make it for the next flu season. It takes about 6 months to do a vaccine run. That's the problem. And so that's why, and for that reason, I haven't had a flu shot in a long time. Last time I had a flu shot, I got the flu. They're not, it's an epidemiologic, educated guess. CDC recommends everybody gets a flu shot. It used to be very old, very young, people in healthcare, people at high risk. Now it's a little bit different. Young, healthy individuals weren't recommended. The one when you start hearing about these nasty, in 2009, there was a swine flu, which means it had pig, the same way COVID had foreign RNA, had pig RNA inside an human influenza virus, and it had what's called H1N1, because we know about, when we get into it in respiratory diseases, we've identified a lot of significant appearances of these protein spikes. That's a phenomenon called antigenic shift, and that's what makes things like COVID-19. So when you have a mixture of genetic material from different species coming together, that's what makes it novel. So we'll close it here. That's why I close the other group. I'll send you some information about Hanta, which is important, and HIV. The other two, not so much. Hepatitis B we have under control. Lassa we don't see. And then I'll give you as much as I can on the rest of the virus for everybody. Thank you. Talked out.